I was little, and Mum was the first person that noticed it, but I was taken to the health visitor when I was a toddler, and she mentioned that my knees bent back further than they should. So that was the first sort of hint that there was something a little bit different about me to other kids. So that was Mum. Then me myself having an awareness of it was really when I did gymnastics. So I did dance from a very young age, and then did some gymnastics trials, and because I was super bendy, I got picked to go into gymnastics at about the age of 7. And then from there I did notice that when I was doing things like handstands, doing press-ups in our strength and conditioning training for gymnastics, that my elbows would go a long way past where everyone else's were, and sometimes I'd get sore elbows. So that was my first awareness of myself, and then obviously as time's gone on, I'm now more aware of things that are not quite right. It's fine, it's fine. And my bendy elbows, so it was always a party trick. So as people have seen on the pictures, you know, my elbows bend past where they should, that's straight, and they go past where they should. And then I could put my hands down and do all these wonderful movements with my elbows. So they were things, elbows, I got a lot of knee pain as a child as well. I remember Mum and Dad taking me to a physio for pain at the backs of my knees. I've had problems, I've seen osteopaths when I was about 14 for back problems. Again, lots of gymnastic based injuries. So we put it, you know, obviously I've never seen a medical professional about my hypermobility. It was just always, oh, she's the bendy one, I can reach for things. Under the sofa, it's quite handy if something's stuck under the sofa, my elbows allow me to reach things that others can't. So yeah, pain I've had in the past, and again, it's just things like being a physio, you know what the conditions are, and you just sort of treat yourself. So when I worked at the NHS, I ended up with horrendous a tendon problem in my right ankle, and I'd done nothing. I hadn't sprained it, I'd not had an injury, I'd done nothing different, hadn't worn different shoes, and I ended up on crutches for a week. It was the most horrific pain I'd ever had just behind my ankle bone, and that was obviously when my tendon was irritated. Had a similar thing when I worked at one of the private hospitals in Brentwood. Ended up with tennis elbow. Done nothing. I don't play tennis. Obviously people that don't play tennis can get tennis elbow. And I had the most horrendous raging elbow pain in here, and I just self-treated and cleared it up. But I couldn't pick up bottles. I was dropping bottles because of the pain in my elbow. So again, all of that is linked back to my hypermobility, where you get that tendon irritation because your joints go past where they're meant to, and the tendons can actually, what we call sublux, they can actually flick over the bones, and that was what was happening in my elbow. I could feel my tendon flick over my elbow every time I bend and straighten it. I feel it now. And also I could feel that in my ankle, so definitely had soft tissue injuries related to the hypermobility as well. Yeah, my joints, now I'm getting older, now I'm in my late 40s, you know, you notice that you're getting the joints are now getting stiffer, so things that were easy to bend are now getting stiffer, but then that comes with aches and pains on a daily basis. There's not a day goes by where I don't have an ache or a pain somewhere. Other symptoms that I get, heart palpitations. I've been investigated for those by the cardiac team at the hospital, but no one's ever, because I've never been diagnosed by a doctor with hypermobility, but I know I've got it being a physio, and I know that I'm on the spectrum of EDS, but no one's ever put all my symptoms together. So yeah, palpitations, I get those. Feels like butterflies inside my heart, which is quite scary the first time you get it. IBS, so I've had IBS for years. It's much better controlled now, but again, it was just, doctor said, oh, it's IBS, it's embarrassing, you've got to live with it. And that was it. I was just left to fester by myself, which is not the answer. But since I've done food intolerance testing, I'm a lot better. But obviously that's a link to the hypermobility. What other things do I get? Low blood pressure. Skin, yeah, I actually scar pretty well. So I know a lot of hypermobile people don't scar very well, but I scar okay. So like when I had my cesarean with my daughter, I scarred really well, so I'm really happy with that. But yeah, I mean, it's a bit more stretchy than other people, and maybe I could blame my wrinkles coming on my face down to hypermobility. That would be nice, wouldn't it? So yeah, they're probably the main things that I noticed with it. I've not had any joints dislocate. I've had it where my kneecap can feel stuck, and where it subluxes, where I think, oh God, it could go on the verge. Had that with my elbows as well. Sometimes my hips get stuck. I mean, literally, I'm like a walking one-man band. I wouldn't make a good burglar, put it that way, because you could hear me. I think I noticed a difference when I stopped gymnastics. So although the gymnastics, obviously, you're stretched into all sorts of positions, and gymnastics coaching has gone a long way from when I did it back in the 80s. But when I was stronger, I definitely had less symptoms. So I now focus more on so I love my Pilates, do a lot of Pilates. Walking, I was realising I love going out for walks. I'm not a distance runner, I was a sprinter as a kid, so I hate distance running. But walking I love, and I can walk for miles, but even that was becoming a problem. And then I've realised in my own brain that I was walking really badly. So like I've said to all the team here, is that I feel like a puppet on a string, like everything clicks and clunks, and it could be really unstable. I literally feel like Pinocchio when he first became a boy. But yeah, it's focusing on activating the muscles to actually get that joint stability. That's really helped me. So now I'm walking so much better. I'm walking further, I'm walking faster, because I'm actually really activating my calf muscles, my hamstrings, my glutes, which I got into a habit of walking really bad. And obviously here I've been, as you guys know, I have treatment every day here. There was a spell where I didn't take care of myself because I've become a mummy and I'm a business owner, and life gets in the way, and I put myself at the bottom of the pile. And you've all seen me coming in my worst moments. But now I've put myself towards the top of the pile and really looking after my health. It's making a difference. And I would say at the moment I'm in a really good phase. And even today I've gone for a walk down the seafront, and I was just smiling to myself thinking, God, this feels so good. It's like, it's nice to not be in so much pain and to be feeling like I'm getting my shape back, feeling like I'm getting fitter, and long may it continue. So really it's just, I mean, Mum obviously, because she noticed about my hypermobility, and my family know about it. And then being here at physio, I have found I've been to, so when I lived in Doncaster for a bit, I went to physiotherapists up there, told them about my hypermobility, and it was almost brushed aside. No, I didn't feel listened to. So I went with my back pain, and I went to some of the top physios in the country, but they just sort of brushed my hypermobility aside, and it's really frustrating that you think, well, actually, yes, I've got back pain, but how much of it is linked to my hypermobility, especially now I'm getting older, and as we know, muscle degrades as we get older if you don't look after yourself, so then things are not as stable. But I never really felt listened to, whereas here, the team have really, we've had a massive increase in hypermobile patients, as you know, in the last year, and I really feel for these people because I am that person, and the team here really, actually, even though I'm their boss, they actually listen to me and treat me as a patient rather than, oh, I'm treating my boss, which is really nice and refreshing. No, do you know what? I can't say I did. I had a really good pregnancy. So I had a back problem before I got pregnant, to the point of I had MRI scan diagnosed that I've got ruptured disc at my L4 disc. It was pressing on my nerve, giving me raging sciatica. It was horrendous. It was the worst time of my life. Had treatment here, and within 10 days of having daily treatment, I literally went from I want surgery to I'm 99% better. And then by the time I saw the consultants at the hospital, they showed me that my nerve root was black, and that's why my leg didn't feel like it was my own. They offered me a discectomy, and I said no. So yeah, so I had that all before the pregnancy. So I was dreading, I love being pregnant, and I was dreading what was my back going to be like. But actually I think, because I'd lost some of my lumbar curve, being pregnant actually gave me a bit of that back. But again, I did Pilates all through my pregnancy. I was teaching numerous classes a week all through my pregnancy. So, by the end I was obviously sitting teaching on a ball with a bump. But yeah, I think the pregnancy, doing Pilates during my pregnancy really helped as well. My nephew's got it. My mum has a touch of it, so obviously, as we know, it runs in families. So if the fact I've got it, I knew mum or dad had it, and it certainly wasn't dad. Mum has a touch of it. As I say, my nephew's got it, and my daughter has touches of it in certain joints, but not as to my level. And then obviously the clients here, we see it every single day. I mean, it's more rife than what people give it credit for. Yeah, I mean, back then, I mean, you know, my family didn't know any different. I was, you know, Bendy Wendy. I mean, my brother-in-law has given me that nickname. My cousin calls me Benders, you know, that's my nickname. It was my family all said, oh, she's double jointed. And back then, when I was little, no one was a medical professional in my family, so no one knew any different. You know, mum's always taken us to medical appointments as and when required. She's a really good mum. I guess it's the health professionals that have failed me when I was younger. And even when I'm older, like I said to you, I've been to various physios about my back when I've lived in different places and couldn't get here. And it's the fact that you don't feel listened to. And that's what's really frustrating. So it's nice when you have people that do listen to you, take it seriously, and incorporate that into your treatments and into your rehab. Because obviously for us hypermobile people, we need a different angle of attack on our rehab so that we create that stability in our joints. Yeah, and with that being said, obviously hypermobility is a passion of mine, and the team have actually really got on board with it. It's been fantastic. So you guys on the admin and all the therapists, and from this, because we're seeing a big, massive influx in it and people are not getting the help elsewhere, we have now generated this class, which is called our HEADS class, which is Hypermobility and Ehlers-Danlos. So this class is going to be specifically for people with those health conditions. If you think you've got it and you're not being listened to, please come along and get one of my team to assess you. There are tests that we can do to screen you. We're doing a screening at the end of May, but if you can't make those dates, we can fit you in during the diary, during the week anyway, because there are so many people out there that the symptoms don't quite fit and no one's listening to them. So if you've got the clicking, you've got the pain, you've got the joints that feel like they could dislocate, you've got the IBS or the constipation or the heart changes, or you've got the low blood pressure and nothing's quite fitting the pattern, please come and get in touch and come and see the team. They're really passionate about it. We are doing more and more learning ourselves about it. We've got a couple of courses coming up for the team to grow their knowledge even more than what they've got now. But as I say, we are starting the class, and it's going to be great because it's going to be tailored for those people. But it's not just going to be an exercise class. There is exercises in it tailored for our community of hypermobiles, and it's going to be led by the team here. But also it's going to be a community support group as well, so you can talk to other sufferers about it. And then you realise it's not just me. There are other people out there, and it's like, oh, you too? Fantastic. Now I don't feel so alone. So, as you know, I've said about it numerous times, when I left the NHS and set up the clinic, yes, I have high expectations. I want a professional service, but I always wanted it to be a place that people enjoy coming to and feel supported and have that community feel. So yeah, so if you have it or you think you might have it, then please come and see us, because there really no need to suffer. And as I say, I'm really getting to a good place now. So know that I'm a 48-year-old woman who's had a child, who had a caesarean section, who's had a long 20-odd year history of low back pain, and know that my life has turned around and that I am getting better.